As you may know, people receive healthcare insurance in different ways. Marcus and his family are going through the process of buying health insurance on their own and then using that insurance plan to receive healthcare services. Let's follow Marcus along his health insurance customer journey. Step 1. Calling a healthcare agent and reviewing plans. Marcus spoke to a healthcare agent that was recommended by a friend. Marcus also visited the healthcare.gov site at least 10 times, spending over 25 hours doing research. Marcus found the process very confusing. Marcus grew anxious about the prospect of having to pick a healthcare plan with limited knowledge of how health insurance really works. Step 2. Receiving quotes from the agent and a registration link. After many discussions with the health insurance agent and healthcare.gov advocates, Marcus settled on a health insurance plan that provided him what he thought was decent coverage at an affordable price. He hoped there weren't going to be any cost surprises later in the year. Marcus was given a link to sign up for the plan and to register his family. Step 3. Registering for insurance online and waiting for approval. After spending hours trying to understand the terminology of the registration form, Marcus completed the form and submitted it. He hoped that he did it correctly and that any incorrect answer wasn't going to invalidate his family's application. During the process, Marcus spoke to several customer support people, but he received conflicting information. Going through the registration process added to his frustration and anxiety about obtaining health insurance. Step 4. Making a payment. At some point, Marcus was instructed to make a payment, and he did. He wasn't sure what the payment was for, but at this point, he didn't want to restart the entire process. Step 5. Receiving ID cards and welcome kit. A short while later, Marcus received identification cards proving he and his family were covered by health insurance. The information contained in the welcome kit explained how to use the ID cards. Step 6. Going to the doctor and getting a prescription. Later in the month, Marcus scheduled a checkup with the doctor. During the examination, the doctor determined that Marcus needed medicine to deal with a health issue and wrote him a prescription. Step 7. Not knowing if the doctor was covered by the plan. Marcus forgot that he wanted to ask if the doctor was in-network or not. The doctor's office receptionist and nursing staff seemed to accept his health insurance ID without concern, so Marcus hoped he wouldn't get a surprise bill later on. Step 8. Getting the prescription filled at the pharmacy. On his way home from the doctor, Marcus stopped by his local pharmacy and got his prescription filled. Step 9. Receiving insurance renewal information prior to coverage lapsing. Marcus will likely receive insurance renewal information from the insurance company 1 to 3 months prior to his insurance plan expiring. The renewal information will state changes in health insurance plan benefits, as well as changes to copay amounts, deductibles, and premium amounts. It will be up to Marcus to complete the forms to confirm plan renewal, or the plan will eventually stop coverage. This has been the story of Marcus, one of the many individuals purchasing insurance for their family in the American healthcare market.